You're listening to Happier Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved one. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. Welcome back to Happier Healthier. As the days get longer and the sun shines brighter, summer is just around the corner, bringing with it rising temperatures, and with that heat comes the crucial need to talk about staying safe outdoors. Today we're tackling an essential topic, heat in your health. We are incredibly fortunate to have Dr. Daniel Boykin with CMC Primary Care Postal Way joining us on the show today. Dr. Boykin is here to share his expert insights and practical advice on how to protect ourselves and our loved ones from the summer heat, covering everything from skin protection to recognizing serious heat-related illnesses. Dr. Boykin, thank you for doing the podcast. We're going to talk about staying safe in the heat. So let's just start with kind of summer safety in general. Like when it comes to skin protection, what are we looking at?
So from a skin protection perspective, we want to understand what are we trying to do? What are we protecting? I might be dating myself here, but like 20 years ago, I don't know if you remember the Real Men of Genius Bud Light commercials. One of those was the Mr. 80 SPF sunblock wearer, and it always made me laugh. It was something along the lines of, there's 24 hours in a day, you're wearing 80-hour protection, and I was one of those kinds of people that, I'm fair skinned, and so I always was like wearing SPF 70, SPF 100. The reality is, SPF has nothing it's not like the number of hours. Obviously, you put on most people wear SPF 30. It's a sun protection factor, right? It has to do with the number of minutes that you're compared to what if you were to burn normally, how much more time you're buying yourself. And so like 97% of your effective blocking comes from SPF 30. Everything else after that is pretty much either more greasy, more likely to be something you don't want to have to reapply every 3 to 4 hours. But so the most important thing for skin protection in the summer is knowing that you are going to have to put that on. I mean, in Myrtle Beach, it is on summer, we're looking at UV ratings of 9, 10, 11, which means that for a fair-skinned person, you are going to burn in 10 to 20 minutes. So sunscreen is kind of a absolute necessity if you intend to be outside for that long. If you don't end up having the ability to get to some shade or something like that, then you have to put on sunscreen.
Obviously, sunburns, they kind of hurt. They don't look amazing, but what are kind of some of the other reasons that it is so important to protect your skin? Because some people are like, man, I'll get a sunburn. It'll turn into a tan, so it's okay.
Most of the time in primary care, I am seeing kind of the aftermath, unfortunately. I have a decent number of folks who've moved here who've kind of not taken heed to using sunscreen. I'm sure dermatology can come on here and say to to some extent how many patients are ending up having to deal with some lesions and that. But that's kind of what we're trying to protect you from. I mean, um, the amount of radiation that you're getting being outside for more than 15 minutes, but much less hours, is a significant amount, and it tends to, you come to the beach for a week, go outside for a couple of days, it just adds to kind of the burden. Medicines that you take, the chronic conditions that you have, all those can affect like your ability to kind of keep your skin protected, kind of keep you cool, in addition to just protecting you from the rays with sunscreen. So you can easily become overheated if you're not able to kind of manage the heat and keep yourself cool.
That was going to be my next question. Can you kind of explain a little bit, I guess, like nerd out a little, like what happens physiologically when we're exposed to high temperatures? How is our skin and our body keeping us cool?
Number one, your skin is your the way that we keep cool is um, kind of initiated by your hypothalamus, that's the control center of your brain. So it's very important for thermoregulation, appetite, those kinds of things. But the hypothalamus detects when your core temperature is above a certain number. I think it's 99 degrees. And when it does that, the vessels in your skin are going to start to dilate. When you start to have dilated, it's sort of like a heat sink. I will nerd out on you. So if you're into computers or mechanical stuff, a heat sink is a way of taking a lot of heat in one little area and trying to diffuse it and get rid of it. So that's what it tries to do. It takes a high core body temperature and tries to say, okay, your skin, we gotta get it everywhere to get it out. So it dilates your cutaneous vessels. Your skin starts to turn pink and warm. Your heart starts to pump harder to try and get as much blood to the surface as possible. And you might, at that point, start to maybe even feel a little bit lightheaded if you stand up too quickly. Um, your sweat glands will start to kind of secrete a lot of salt water. And the purpose of that, if we were in Arizona, if we were in a desert, it would work perfectly because it's dry outside. There's no humidity. You get evaporative cooling, and that was what it was designed to do. But as we know, here in South Carolina, it's very humid most of the time, and it just sort of gets slick and sweaty and clammy, and it doesn't have that cooling effect the same way, and so you can easily because of that reason. But the kidneys will try and conserve water because you're pumping out 1 to 2 liters of water, of salt water, to try and keep you cool, but it's not working. Your electrolyte replacement needs to, if you don't get enough electrolytes, you'll start to get heat cramps. Your muscles will start aching. You'll get some abdominal pain, and we'll talk about it later. But fatigue, thirst, headache, those kinds of things are kind of cluing you into you're starting to fail a little bit, and you're going to need to get some fluids right away at that point. So, but in general, the evaporative cooling is the point of, what the hypothalamus is trying to tell your skin to help it with.
Interesting. So when the body does not successfully cool you down, is that when heat-related illnesses happen?
Heat cramp, and everybody knows this from like sports and stuff, but heat cramps, heat exhaustion, heat stroke, all those kind of terms. There is different levels of kind of when things to kind of look for. Heat cramps, you're sweaty, your temperature's less than 101. You might get some cramps, especially like in your legs or your calves, abdominal cramps. And what can you do? I mean, at that point, everybody knows you need to drink some water. You need to find some shade, get some air conditioning if you can. Drink some, electrolytes. Have some sports drink or something. And if you don't do that, that's when you can get kind of to the point where you might pass out, pale, clammy, dizzy, semi or perisyncope or almost fainting, laying down, elevating your legs might be necessary in order to keep conscious. But that's the point where it starts to become, things start getting real. You might need to involve EMS, you might need IV fluids, you might need to, if you're not conscious, obviously you're not able to drink and get some um, salty snacks or something in you. Heat exhaustion is kind of the point when you're getting pulled. If you're an athlete, you're getting pulled from the game. You get cold and cool and clammy. That's a bad sign. You should be warm and pink. If you're cool and clammy, things have gone wrong. Your core temps, over 100, but usually less than 104. You're getting nauseous. You're getting flu-like symptoms. You have to get out of the sun. You've got to get into some cool. I think even most high school sports I know have like a regulation that says you have to have a spot or a cooling bath or something like that, just in case this type of thing happens. And if it's not improved in a certain amount of time, usually about 30 minutes, you're going to have to be calling 911 to get you to the emergency room, which is to prevent you from heat stroke. Heat stroke's the emergency. That's when you're hot, you're dry, all of your systems have failed. You're no longer kind of compensating. You're sweaty, but that might be because of just residual sweat and the fact that it's humid outside. But most of the time, you're going to see, if things don't get better, you're going to see arrhythmias, you're going to see seizures. You'll probably definitely be unconscious. So that's the part where, in EMS, they're telling people to shove ice packs in all the places that you can. And the armpit, the big places where big vessels come to the surface. So like the armpits, the groin, the neck, things like that. And most, trainers and EMS staff and all that will try and do that for you. But those are kind of the progression of, things to look out for. Obviously, we don't want to wait until you're at a heat stroke to do something about it because that's when you're in the hospital. But heat cramps is definitely a time when go ahead and start finding your shade. Go ahead and start drinking plenty of fluids, realizing how much you can lose. Like I said, 1 to 2 liters of uh, um, salty liquids. You're losing every hour. So you need to replete that.
So would you say kind of the biggest tips are hydration? And when you say salty water, do you mean like Gatorades or like electrolyte packets? What are some things that people can do to prevent that?
Yeah. So if we're talking, there's going to be a lot of sports camps and stuff like that during the summer. If we're talking athletics, you're going to need to prehydrate. You're going to have a water bottle, half a liter, um, before, and that's water or Gatorade or sports drink. You're going to want to do that 2 to 3 hours before your game or event. And then right before the activity, you're going to want to drink maybe half to a full water bottle just to kind of be ready, knowing that, and this is, if we're talking about like 90-degree days, this is important. During the event, you're going to want to maybe half a bottle of water, on average every 20 minutes or so. Um, your non-athletes, if you're just an average everyday person outside, it's also pretty dangerous. The average person, a lot of people are like, well, how much water should I drink? I mean, the average female is about 2.5 liters to 3 liters. Male 3.5 to 4 liters. Um, so if we're, that's 1 liter is 2 water bottles. So for the average person, 120 milliliters every 20 minutes is what they say. So um, to if you're exposed, but if that's just exposure. If you're actually doing something like walking briskly or doing yard work or something like that, you probably need about 200 milliliters or a half a bottle of water roughly every 20 to 30 minutes. So staying hydrated, if you're outside more than like 90 minutes, that's when you go for the Gatorade and or the sports drink, something with electrolytes in it, because at that point you've sweated enough to lose those.
Before we wrap up, I know you wanted to kind of talk about leaving things in cars, whether it's children or dogs or people or what. I mean, how is that dangerous always, but especially in the heat?
So 75% of the total temperature rise happens in the first 5 minutes in a car. So we're talking 100 up to 150 degrees within 15 minutes, even when the windows are cracked. And so, I'm just going to run in real quick. It shouldn't be in the vocabulary. Not when we're talking about the kind of heat that we experience here in South Carolina. 39 deaths in 2024, child deaths in hot cars. So, this happens, and I think I'll kind of give a little tidbit. Like, I'm not when I had my first kid, I'm not the primary parent. Like, I was always working and stuff. And so, like, when he was in my car, I was always petrified that, I would be going about and doing something and leaving. Like, it happens to people. Like, in EMS, I was called all the time for a kid locked in car or something like that, and, without being judgy, you don't think about it, but it is very easy to, when your routine is the same, if you don't do that every day. So for the non-primary parents who aren't driving their kids around all the time, put your keys back in. Most of the time, things are just like, as long as the keys are in the car, you hit the button, you're fine. So put something with your kid that you cannot leave the car without, so that God forbid, don't forget. Um, because it's absolutely devastating. Even 5 minutes can be absolutely devastating. So, if the engine's off, everybody should get out. That's and as far as pets are concerned, dogs don't do so well. Pets don't do well. 106 degrees is all it takes for them to have organ damage. So, if you can't take them inside with you, don't plan to bring them with you. Um, even with the windows rolled down, that's not good enough. Um, so, it's very important to be conscientious of who's in the car and not say, okay, well, I'll just run in real quick.
Yeah, awesome. Where were you a paramedic?
I'm originally from the Raleigh, North Carolina area. I was a paramedic before I went to medical school, which was a while ago. So I have not. When you asked me initially about doing this, I was like, well, I haven't really attended to uh, heat-related emergencies in a long time. But it is important, primary care. We need to. A lot of people have, especially my patients, have moved here from elsewhere, right? And so
Mhm.
they might not know how humid it can get here in the summer if this is their first summer here, and how I did the opposite. I had lived in Arizona for 4 years, um, and if you're not used to a dry heat, you can be outside in 90-degree, 95-degree weather, and the first sign that you realize that something is going wrong might be you being dizzy because your body has worked exactly the way it was designed. Evaporative cooling, it's comfortable outside because the humidity's low. You've got sunburn, and but you're comfortable until your electrolytes are gone and you're dehydrated. And when we took our first trip out there and went to the zoo, I was probably in early heat uh, exhaustion and didn't even realize it. But out here, it's a little bit easier because that evaporative cooling doesn't work so well with the humid environment. But yeah,
Well, thank you so much for doing this. I'll let you go.
you're welcome. It's a pleasure.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.